So specialty hospitals, industry products. I'll read. Sorry, guys. I have a throat infection. That's why I'm just sipping on the hot liquids. Okay. So specialty hospitals in industry products. First is the long-term acute care hospitals, inpatient rehabilitation facilities. We have discussed about the rehabilitation centers and all, right? Then children's specialty hospital, that is pediatric hospital, cardiac facilities, orthopedic facilities, women facilities, rehabilitation facilities, eye and ear facility, arthritis treatment facility, cancer hospital, geriatric hospital, chronic disease hospital, nose and ear hospital. So one by one, we'll just discuss in slides. So first is the long-term acute care hospitals. Long-term acute care hospitals. So specialized hospitals providing comprehensive medical services for patients with complex medical conditions requiring extended hospitalization. Equipped with advanced medical technology and specialized healthcare professionals to address the unique need of long-term acute care patients. Focus on providing intensive medical interventions, rehabilitation, and support services to promote recovery and improve patients' outcome. So first is the long-term acute care. Long-term acute care means those patients will stay for a long term, more than 2 weeks. So these specialized hospitals providing comprehensive medical patients with complex medical requiring extended hospitalization, maybe post-surgical care up to 1 month, or the patient with Alzheimer's diseases. We have discussed, we have dementia centers and geriatric, mainly these geriatric centers and those patients with memory loss or any physical disability conditions means will stay for a long time. So equipped with advanced medical technology and specialized healthcare professionals to address the unique need of long-term acute care patients. Focus on providing intensive medical interventions, rehabilitation, and support services to promote recovery and improve patient outcomes. So that is long-term acute care hospitals. Then comes the inpatient rehabilitation facilities. In the last sessions, I think we have discussed about the rehab centers and all. Rehab centers are those areas in which the patient is helping the patient to come back to his normal routine life by doing his own things in a routine basis, right? Independently. So that is rehab centers, mental rehabilitation centers, and physical rehabilitation centers is there. We also know there's a drug in case of drug abuse and alcoholism and all. We'll send the patient to this or the clients to the rehab centers for 1 or 2 months to just to retain back the patient's normal life. The facility is dedicated to providing intensive rehabilitation services for patients recovering from injuries, surgeries, or medical conditions. If the patient met with an accident or any serious injury means the patient is after the critical medical treatment, the patient is transferred to this rehab centers for rehab centers if to cope up with his disability. If the patient lost his arm or has lost his leg in the midst of this accident and all, after the patient is sent to this rehab center, from there they will make the prosthesis, leg prosthesis or hand or arm prosthesis, and they will make the patient get adjusted to that prosthesis. These rehab center people, there will be a physician, staff nurses will be there, lots of people helping the patient. These people make the patient feel to or make the patient adjust with a new prosthetic limbs or new prosthetic arms and all, make the patient confident, make the patient mentally and physically adjusted to his new condition, etc. So the rehab facilities, that is totally making the patient to overcome his difficult time. That is rehab centers, okay? Offer a multidisciplinary approach to rehabilitation, including physical therapy, occupational therapy, speech therapy, and specialized medical care. So physical therapy means we have discussed like a routine set of exercises just to make the patient strengthen his muscles. In case of speech therapy, same way, after a stroke or after any accidents or any due to any vocal cord injuries and all, the patient might not be able to have a proper communication or clear conversation. So pronunciation, everything deteriorate. So this speech therapy will help the patient to retain back his normal, not completely, somewhat like he had a normal conversation. So the in speech therapy, the speech therapist will come and train the patients. Okay, pronunciation exercises he will give, tongue exercises, mouth exercises, just to strengthen this talking muscles and all. So just then with using the flashcards and all, making the patient to read loud. So they will give a set of exercises. That is speech therapy. So and speech therapy is also not only in case of accident or geriatric patients, it also be you seen in kids also. After 3 years and after, if the kids is not speaking properly or he can't make sentences, means we'll go to the speech therapist. They will give this speech therapy or pronunciation therapies exercises to the kids to make them properly communicate. Okay, we know that if after an major accidents or anything, means if the patient can't properly talk, means or he can't communicate his feelings or his talk, communicate with his family members, means that will lead to a great irritation or frustration, right? So just to overcome that situation, this speech therapist will not only improve his communication skills, but also he will boost his confidence, right? And specialized medical care. So that's about the rehab centers. I think who have listened the earlier classes will know about the speech therapy. Then occupational therapy. Occupational therapy is like the making the patient to able to do his own work, like eating, taking bath, walking, etc. His own. Okay, that is occupational therapy and specialized medical care. So these are the multidisciplinary approach to rehab. Then focus on restoring functional abilities, improving mobility and enhancing overall quality of life for patient through a personalized rehabilitation process. So focusing on the restoring the functional ability, improving mobility. In case of old patients and all, their immunity is a major issue. They can't walk properly without maybe due to their less confidence or maybe due to their fear of fall, etc., they will not walk properly. So they will improve their mobility by using the other structures, like when stretchers, a crane and all. So they will with that instruments and all, tools and all, they will make the patient to walk without fear. So that is all the things in the rehab facilities. Then children specialty hospitals. So hospitals specializing in providing comprehensive healthcare services for pediatric patients from infancy through adolescence. Offer a wide range of pediatric specialties, including pediatric surgery, neonatology, oncology, cardiology, and neurology. Provide child-friendly environment, specialized pediatric medical equipment, and a team of pediatric specialists trained in pediatric care. We know that from the newborn to at the age of 18, we will go to at the age of 18. That age is confined to the pediatric department. That area, if the child or the children, any diseases are there, means we'll go to this pediatric doctor, pediatrician. So what is this neonatology? Neonatology, that is main department which deals with the newborns having any congenital diseases or the newborns risk babies, like we say risk babies. Risk babies or like chronically or congenital diseases, any congenital diseases like then coming to that neonatology also deals with the patients with early born patients, okay, preterm born patients, etc. So that group of newborns are dealt with this neonatologist. Then oncology, the patients dealing with the cancer patients. Then cardiology, congenital heart disease and all, means this pediatric cardiac surgeon will deal with the neurology, any disturbance with this nerve department. So that is the children's specialty hospital. So children's specialty hospitals is a multi-speciality, means that hospital includes this pediatric surgeon, neonatologist, oncologist, cardiologist, and neurologist, etc. They will provide a wide range of treatment to the patients, that is children group under newborn to 18 years of age, that is pediatric department. So that is children's specialty hospital.